Hello and welcome. Today we're diving deep into a critical cardiac condition known as hemopericardium. This is a serious situation where blood accumulates within the pericardial sac, the protective layer surrounding the heart. Join us as we explore its causes, effects, and potential treatments. Hemopericardium has a range of potential causes. Trauma, such as a chest injury from a car accident or surgery, is a significant contributor. Myocardial rupture following a heart attack can also lead to blood leaking into the pericardial space. Other culprits include aortic dissection, a tear in the wall of the aorta, certain cancers, especially those that metastasize to the heart, and complications from invasive cardiac procedures, such as pericardiocentesis or pacemaker placement. Rare causes encompass bleeding disorders and anticoagulant medications. The pathophysiology of hemopericardium revolves around the accumulation of blood within the pericardial sac. As the blood volume increases, it exerts pressure on the heart, restricting its ability to fill properly during diastole, the relaxation phase. This pressure leads to decreased cardiac output, meaning the heart can't pump enough blood to meet the body's needs. In severe cases, this can progress to cardiac tamponade, a life-threatening condition where the heart is so compressed that it ceases to function effectively, causing shock and potentially death. The exact epidemiology of hemopericardium is difficult to pinpoint, as it often arises secondary to other conditions. Its prevalence is dependent on the incidence of its underlying causes, such as trauma, aortic dissection, and cardiac rupture. Studies examining these underlying conditions indirectly provide insight into the occurrence of hemopericardium. For instance, the incidence of traumatic hemopericardium would be related to rates of significant chest trauma in a population. Risk factors largely mirror those associated with the underlying causes, such as hypertension, smoking, and connective tissue disorders for aortic dissection. The signs and symptoms of hemopericardium can vary depending on the speed of blood accumulation and the degree of cardiac compression. In acute cases, patients may experience sudden onset of chest pain, shortness of breath, lightheadedness, and anxiety. Classic signs of cardiac tamponade, known as Beck's triad, include hypotension, distended neck veins, jugular venous distension, and muffled heart sounds on auscultation. Other potential symptoms are palpitations, dizziness, swelling in the legs or abdomen, and in severe cases, loss of consciousness. Diagnosing hemopericardium involves a combination of clinical suspicion and diagnostic testing. An echocardiogram is the primary imaging modality, allowing visualization of the pericardial effusion and assessment of its impact on cardiac function. A chest X-ray might reveal an enlarged cardiac silhouette. Electrocardiogram ECG changes, such as electrical alternans, may also suggest cardiac tamponade. Finally, pericardiocentesis, the removal of fluid from the pericardial sac, can be both diagnostic and therapeutic. Analysis of the fluid confirms the presence of blood and helps rule out other causes of pericardial effusion. While hemopericardium itself isn't categorized into distinct types, the underlying causes often dictate the clinical presentation and management approach. Hemopericardium secondary to trauma will differ in management compared to hemopericardium resulting from an aortic dissection or cancer. Understanding the underlying etiology is paramount for effective treatment. The treatment of hemopericardium focuses on relieving the pressure on the heart and addressing the underlying cause. Pericardiocentesis is often the first-line treatment for cardiac tamponade, providing immediate decompression. In some cases, surgical drainage of the pericardial sac may be necessary, particularly if the effusion is large, recurrent, or associated with significant clots. Management of the underlying cause is crucial. This may involve surgery to repair a cardiac rupture or aortic dissection, chemotherapy or radiation therapy for cancer, or adjusting anticoagulant medications. Preventing hemopericardium primarily involves minimizing the risk factors associated with its underlying causes. This includes promoting heart-healthy habits such as maintaining a healthy blood pressure, avoiding smoking, and managing cholesterol levels. Prompt diagnosis and treatment of conditions like aortic dissection and myocardial infarction are also essential. Appropriate safety measures, such as seatbelt use in vehicles, can help prevent traumatic injuries that could lead to hemopericardium. The prognosis of hemopericardium depends largely on the speed of diagnosis, the underlying cause, and the effectiveness of treatment. If cardiac tamponade is rapidly recognized and treated with pericardiocentesis, the prognosis can be good. However, delays in diagnosis or treatment, or the presence of severe underlying conditions, can significantly worsen the outcome. Recent research focuses on improving diagnostic accuracy and developing less invasive treatment strategies for hemopericardium. Advances in imaging techniques and surgical approaches continue to refine the management of this challenging condition.